JACC highlights. I'm Khurram Nasir, one of the associate editor, and I'm really thrilled to have this fascinating discussion that's lined for all of you today. So today we are diving into a very important topic in cardiovascular and renal health, specifically the role of influenza vaccines in patients with chronic kidney disease. And our guest today is the lead author and senior author of a secondary analysis of the DANFLU-1 study, which will be published in JACC simultaneously and present on JACC.org with their presentation at ESC tomorrow. Dr. Tor Biering-Sorenson, who heads the Center for Translational Cardiology and Pragmatic Randomization Experiment, University of Copenhagen, Denmark, is with us here today. So just to give you an opening is that the study we are discussing today, DANFLU-1, is a pragmatic open label active control trial that compares the effectiveness of high dose quadrivalent influenza vaccine to a standard dose quadrivalent influenza vaccine in patients with CKD in this subgroup analysis, addressing a crucial question that does a high dose influenza vaccine offer better protection against influenza, pneumonia, cardiovascular outcomes in CKD patients to the standard dose. So Dr. Biering-Sorenson, thank you so much for joining us today. To start, could you tell us what motivated you and your team to undertake this study, and what gaps in the current research were you aiming to fill?
First of all, thank you so much, Dr. Nasir, and thank you for the opportunity to discuss our study with you here today. So you very elegantly introduced our study here in the introduction. And first of all, you know, for the background of why it's important to talk about vaccines, and here more specifically flu vaccine in other diseases than just, you know, preventing a flu, is that within the last 2 decades we have realized that vaccines such as flu vaccine actually potentially also prevents outcomes downstream that happen after a severe infection. So that's, you know, why it is important to talk about vaccine in many different chronic diseases. And for me as a cardiologist, of course, in cardiology and in the renal space, it's important. We know that a flu infection causes some of these severe outcomes, including cardiovascular and renal metabolic outcomes when people get infected. So trying to prevent flu is of the utmost importance. And we already know that the improved flu vaccine, the high-dose flu vaccine, prevents a positive flu test. So the new thing that we are assessing here is whether an improved vaccine also may protect against clinical outcomes. So the DANFLU-1 trial, as you elegantly introduced, was a pragmatic feasibility trial. So it was a randomized trial of almost 12,500 participants aged 65 to 79 years of age. But it wasn't powered for clinical outcomes. But because it was done in a pragmatic way, we obtained data on hospitalizations automatically through the nationwide registries. And that's why we could assess whether there was an association between which vaccine you were randomized to and then the downstream outcomes. So currently, no data exists within the scope specifically assessing whether an enhanced flu vaccine, the high-dose flu vaccine, significantly lowers the risk of clinical outcomes in patients with CKD. In the DANFLU-1 trial, we had approximately 2,500 participants who had chronic kidney disease at baseline. And we define chronic kidney disease as either having an ICD-10 code of a chronic kidney disease or an eGFR below 60 obtained by chemistry samples obtained more than 19 days apart, or a urine albumin creatinine ratio of above 30, or urine albumin above 20. So that was how we defined it within the study population. And as mentioned, we had a big group consisting of almost 2,500. And we already know from the DANFLU-1 trial that a high-dose flu vaccine is associated with lower risk of being hospitalized for pneumonia and influenza. We actually also know in a recurrent event analysis that a high-dose flu vaccine in DANFLU-1 in the general population lowered the risk of being hospitalized for all causes. But here in this analysis, we specifically looked at whether this was also true for the pre-specified CKD population.
Excellent. That makes a lot of sense. So, could you walk us through some of the key highlights of your finding and what did the study reveal about the effectiveness of a high-dose influenza vaccine that you have described in the general population, but relevant to the CKD patients compared to the standard dose?
We found that the effect of a superior protection with the high-dose flu vaccine was consistent regardless of whether patients suffered from CKD or not. We, however, also saw absolute estimates indicating that the protection could potentially be more beneficial in the CKD population, since the effect estimates were slightly better in the CKD population. But we have to bear in mind that none of the tests for effect modification were significant, so it's only hypothesis generating. But the good thing is that DANFLU-1, it was our feasibility trial where we randomized 12,500 Danish citizens over one season. Since DANFLU-1, we've moved on to conducting the DANFLU-2 trial, which we have already conducted the last two flu seasons. And this flu season is actually the last season where we include participants in our DANFLU-2 trial. And that trial will consist of more than 300,000 randomized Danish citizens, where we will have sufficient power to come with potentially also the definitive answer of whether a high-dose flu vaccine, so an improved flu vaccine, might also be important to implement in the specific chronic kidney disease group, because here in that study we'll have many more individuals in the society with a history of chronic kidney disease.
That's really fascinating. Just wanted to pick your brain on the thoughts whether you think that the findings from this study can move the needle on the policy beyond just hypothesis generating. And in the DANFLU-2, just curious, do you have a pre-specified, at least an analysis plan specifically for this high-risk CKD population?
No, that's a great questions, and in short, DANFLU-1, it was a feasibility trial, but the unique thing is when we embed a trial within the nationwide registries, we get data on clinical outcomes automatically, right? So it would be waste of data not looking at these outcomes within the registries, but we have to be honest that it wasn't powered for those outcomes, right? So we should take the DANFLU-1 results that we publish tomorrow in JACC as hypothesis generating. They are encouraging results, underscoring the importance of getting a vaccine in general and the importance potentially of getting an improved flu vaccine in general, but also specifically in this subgroup for patients with CKD, because as mentioned, we did see that the effect estimates seem to be better in the CKD population. Again, the effect modification assessment weren't statistically significant, but it's too early to say with certainty that a high-dose flu vaccine is superior than a standard dose flu vaccine or similar superior to a standard dose flu vaccine in the chronic kidney disease group specifically. But again, in 1 year, hopefully we will come with a definitive result. And yes, we have pre-specified this subgroup analysis in the DANFLU-2 trial. And we have used, of course, the learnings from the DANFLU-1 trial to modify and improve our study protocol for the DANFLU-2 trial. And the DANFLU-2 trial, because we are cardiologists, us who are executing this study, is powered, of course, for hospitalizations for influenza and pneumonia, but it's co-powered for the outcome of cardiorespiratory hospitalization, similar to the INVESTED trial, which also tested high dose versus standard dose flu vaccines in patients, in high risk patients with heart failure.
Well, thank you so much for leading this way in such an important phase. When we look at the real world, truly, this is an underappreciated space, and a huge inertia exists in vaccination, at least what we have seen the data within US, and associated with a lot of challenges for underserved communities and those with high social risk factors. But by the time, at least for in the interim, what would be your message for healthcare providers and health system, considering vaccinations for flu for patients with CKD and similarly high risk group? What are the strategies that we can do at least to push the agenda and not only identifying but providing this very simple, effective population level intervention?
So first of all, I agree completely, and I think the most important thing to be aware is the importance of just getting a vaccine. These trials, the DANFLU trials, we're trying to assess the potential increased benefit of using improved vaccines, right, for flu specifically. But in general, we see now that within the Cardiology Society and Nephrology Society, that the recognition of the fact that a flu does not only prevent, a positive flu test or a person getting sick from flu, but it also prevents downstream cardiovascular and renal outcomes, is a very important thing to notice. And that is also why a flu vaccine is currently being recommended in most of the cardiovascular guidelines. Of course, depending on which trials data we have, the level of evidence level differ, but it is being recommended in general. Unfortunately, we still see that the uptake in specific high-risk populations are not optimal. In Denmark, we see that the younger CKD population, the uptake is close to 30%. That's simply too low. When we have the knowledge and we know that for a CKD patient, a flu vaccine not only protects against a positive swab, but it potentially also protects the kidney. It's a downstream event, and the fact that we realize that vaccines protect beyond just the flu is extremely important for societies that are not infectious disease societies, but cardiovascular societies, nephrology societies, and so on, to recognize. And I think the fact that JACC also chose to publish a paper like this in a journal is one of the important parts of making us physicians aware about the importance of thinking about vaccines, not just as mentioned as protecting infections, but protecting the heart and the kidney. So I think we need to, as physicians, take care of our specialty patients, to think of vaccines as more than just preventing flu.
Well, Dr. Biering-Sorenson, thank you so much. This has been an incredibly insightful discussion. And I also want to take a moment to explain, as you pointed out, why we felt this study was a great fit for publication in JACC. And JACC, we are always on the lookout for research that's going to push the boundaries of our understanding in the cardiovascular and related fields. And more importantly, it's around the direct impact on clinical practices. And what you just pointed out, you have highlighted a huge gap in vaccination. And this study addresses a critical gap in our understanding of effectiveness and potential population level opportunities for high dose versus standard dose influenza vaccine in high risk groups like CKD, which is associated with an elevated complications and mortality, not only from influenza, but cardiovascular disease. And your study, real world, I would say very pragmatic approach, is giving us valuable insights that is directly applicable to clinical practice, aligning perfectly with our commitment to advance cardiovascular care through impactful research like yours. So we again appreciate your time and expert, and I'm sure the listeners have gained a lot from your insights. Just wanted to see if you have any closing remarks and thoughts for us.
First of all, I want to thank again JACC and you, who has been the handling editor, and it is so important that we bring these studies about vaccines and flu in the cardiovascular space, because we do see a low uptake, right? And then I just want to underscore the next year, hopefully we can have a conversation again when we have the results from the DANFLU-2 trial, where we randomized more than 300,000 using exactly the same systems, where we have a much greater statistical power to assess outcomes like these in the CKD population. So thank you so much.
Again, there's so much to learn, not only from your study, but the infrastructure in what I would call the future of pragmatic trials. So again, I appreciate your team in really leading the way for us, showing us the future generation trials that needs to happen. So in the end, I just want to thank all our viewers for tuning in today. Be sure to check out the full study at JACC.org for a deeper dive into the findings. And I would say until next time, stay healthy and informed, but make sure your high-risk CVD patients, including those with CKD, get vaccinated with flu vaccine. So thank you so much.
Thank you.